Good afternoon, everyone. Welcome to this SOM webinar. I'm Nick Pearl, Chief Exec of the Society of Occupational Medicine. The webinar is about wellbeing in the workplace with Rachel Faulkner. So really looking forward to this. From our perspective, it's really good to link wellbeing and occupational health. It's really important that wellbeing is evidence-based, and we think occupational health professionals are well placed to choose the right wellbeing interventions, work with wellbeing professionals, and it's really to see the focus on occupational health in the budget last month or this month, March, and occupational health being seen as important to grow workplace health through SMEs and other interventions. I think 400 million was declared going to be invested in mental health and MSK online tools. So we're working with the Treasury on that, and everyone's objective is to improve workplace health, prevent terrible tragedies like suicide. I've just come off a call with the Department of Health about suicide prevention, and things like organisation interventions, good manager behaviour, people really focusing on well-being, and occupational health professionals being the people we see as holding the ring, working with others, EAPs and wellbeing professionals, as a kind of critical sort of strategic way forward. We are planning a kind of discussion white paper on occupational health and wellbeing. We're going to work with Dr. Kevin Teo from Birkbeck, University of London, about how occupational health and wellbeing interacts, and the evidence base and the definitions. So if you're interested in that, do contact me up at my email in the chat. But enough about me. I'm going to hand over to Rachel Faulkner. The slides will be available afterwards, obviously being recorded. I've already seen the slide deck. It looks really interesting, really good coverage of the key kind of wellbeing interventions and how it works with occupational health. And really happy that you've got time today to present to us, Rachel. So over to you. I'm sure you do a better job in terms of just explaining about your background, because I know you've got a great background in this area. So thank you.
Oh, thank you, Nick. Yeah, well, thank you all for having me, and it's a pleasure to present to you guys today. Yeah, as Nick said, I thought it'd be really good to sort of give you a little overview about myself. I'm absolutely passionate about health and wellbeing. Prevention is key. I worked in the NHS for 21 years until 2 years ago, and then decided wanted to set up on my own and make a real difference. And my roles within the NHS were around a health promotion specialist, and then I ended being a health and wellbeing lead, looking after the health and wellbeing of staff within a trust in Cornwall as well. So hopefully that gave me some real practical experience, and some of the barriers that I'm sure you guys facing when we're trying to really get wellbeing up that agenda. In 2014, I was fortunate enough to win a Royal Society of Public Health Award for a piece of work where I set up a Healthy Workplace Award programme in Cornwall. And ever since then, I've had the privilege of being assessor at the annual Royal Society of Public Health Awards for the workplace category, which has been brilliant because you get the privilege of looking at across the UK and Ireland of all the submissions that they're doing some really great practice around health and wellbeing in the workplace. So I feel really privileged to be part of that, which is great. And I learn lots from that too. I'm a real advocate for leading by example, so I try my best. And sport and exercise or movement really has always been my medicine, and I'm so lucky that I live in Cornwall. So I try and use that green and blue gym as much as I can. I've got 10-year-old twins, so they keep me super busy, and luckily they're really active as well, which is great. So that's a little bit about me, but really hopefully got lots of experience of trying to get wellbeing on the agenda within private, public and voluntary sector organisations. So first of all, I always think it's really important to lead by example and sort of share little things, small change, big difference. So I really encourage you all. I hope you've got your water or a drink to keep hydrated. I did some work with the NHS, and I did some hydration on 400 staff, and 85% were dehydrated. So I think it's really important we keep hydrated. And again, I know my lovely colleague, Professor Tony Wolfe, spoke to you ago about musculoskeletal health. Just mentioned, that's a big area going forward. If you want to move around, you've not got your cameras on probably anyway, so feel free to stand up, stretch. Really important to sort of don't feel like you've got to sit still for an hour. And they're just some of the health benefits of water. And I always think it's just really important to remember the small things and actually how that can have a big effect on our concentration, our headaches at the end of the day, things like that. Everything that we probably tell our clients and patients, and do we do that ourselves? So this session, I thought I'd talk a little bit about well-being, why it's really important in the workplace, and I'm guessing you guys are advocates and a great audience to speak to about this. From my experience, what are really the essential ingredients? And I've had the privilege of working with Dame Carol Black for sort of over 12 years. And I think she's got some, got the nail on the head really when we look at some of those essential ingredients. And then I thought I'd pick out a few specific health topics in the workplace, which are, really great areas to sort of focus on. But the thing is with wellbeing, it is so varied and, wide, isn't it? I thought I'd pull out some examples of good practice and then look at what can work for you as well. And hopefully you might have some questions and maybe share some of the great things that you're doing as well. So I hope that sounds okay for you all. So first of all, what is well-being? Well, I'm probably the same as you. Often people think it's the fluffy pink stuff, but actually it's really, really important. And it's a real pillar, I'm sure, for the work that you're doing. And I think that one thing about COVID, it really raised the importance of our own staff health and well-being. So for me, just two nice quotes here around the state of being comfortable, happy and healthy. And for me, I know when my well-being's good, I do feel good, I feel happy and healthy. And the New Economics Foundation have done a lot of work around well-being. And the quote there is really, really important. And they also did some fantastic research around the 5 ways to well-being, which many of you may have heard of.
Sorry, Rachel, your slides aren't going forward, and you probably need to also put it on full slideshow because it's still stuck on slide 1. Yeah.
Oh, I'm so sorry about that, guys. Is that any better? Is it moving?
Yeah, and can you put it on full slideshow?
Oh, it does say it's on mine here. Let's have a look. Let's try it this way. Is that better?
Kind of. It's not. There we go. That's it. You got it. Thanks. That's perfect. Thanks.
Okay. Oh, sorry, guys. I just clicked through there. Apologies for that. It was working on my system. Oh, yeah. So the 5 ways of wellbeing model by the New Economics Foundation found that actually, if we did these 5 things daily or weekly, it would actually impact and increase our personal resilience. So it's an evidence-based model, and many of you may have come across this. And I always think it's not rocket science, connecting, being active, taking notice, keep learning and give. But I think it's a really nice model to use often within any workplace around sort of the core evidence base of those 5 things, and even just doing 1 or 2 for individuals. Hopefully it can give food for thought around that. So that's a really nice model to utilize. Again, I'm speaking to the converted here, but that importance of the workplace, we spend over 70% of our waking hours within the workplace. And I think one thing about COVID really emphasizes the quote around the first wealth is health. And Dame Carol Black will always say you need good health to work, and work can give you good health. And I'm sure, being an occupational health specialist, you guys see that all the time, and actually that impact that can have. So I think it's just really important to set the scene again. What a fantastic opportunity the workplace is to really promote, prevent and protect the health and wellbeing of our staff, ourselves as well. So just some statistics here, staggering statistics around the cost of ill health in the workplace and mental health. Mental ill health now being the biggest reason people are taking time off sick, costing well over £45 billion. Millions of days lost due to that, and actually presenteeism when people are at work but not feeling well. And how do we measure that? But again, that costing is very high. Benefits, loads of benefits, and more research coming for you, which is fantastic. And I love the one from the British Heart Foundation, which says for every £1 invested, you will save £4.17. And for me, that's that investor save, really being proactive rather than reactive. And I see that a key role is you guys. And I've worked with some fantastic occupational health nurses in the Southwest, actually, with their network. And they always say they want to do more proactive stuff, but they often get stuck in that reactive stuff. So hopefully that will give us more impotence to try and, get that going. Again, you guys will know some of the statistics here, but I just thought it's really nice just to refresh some of those important around long-term conditions in the workplace, mental health conditions, musculoskeletal, really, really important topics. And I'm sure many of your employees coming to you for advice on these areas. And, you know, over 52% of employees access occupational health. And I'm sure that's even more in other places. So you guys are key to really helping, you know, try and embed wellbeing in your key messages. I think that's so, so important. I just love some of these quotes here. The one I really like at the bottom there: when people are happy and well, businesses can thrive and societies flourish. You know, staff are the greatest asset within any organisation. And I think, you know, Richard Branson years and years ago really had, you know, took care of his, you know, if you get that right, impact on, you know, your organisation and how that gives you that competitive advantage. And I know going into many workplaces across the years, I walk in straight away, you get a feel for a place, and if it's a good vibe and how staff feel treated and valued, it really does sort of set the scene. So occupational health, again, you guys are obviously the expert in this, and but I was chatting to some of my colleagues and they sort of put it down to sort of 4 key pillars there around health leadership, health risk management, fitness for work, and well-being. So a huge, you know, array of areas that you guys work on, but well-being is in there, which is fantastic. But as I said, talking to my colleagues, you know, specifically in the South West Occupational Health Network, well-being is often something they want to do more of, and we often are more reactive than being proactive. But it's really lovely to see it's a building block, and really, you know, hopefully you guys can get more of an opportunity to embed those good health messages and advise on hopefully trying to build on those healthy lifestyle choices, messages, and helping staff to really build resilience. And I think, you know, a tough few years have happened within the workplace setting as well. And how can we do that a little bit more? So again, here, I just think I've sort of pulled some work out from the Facility of Occupational Health and Nursing, and chatted to some guys at the Health at Work National Conference at the NEC a few weeks ago that some of you may have been there. I was presenting on some men's health work there, but I chatted to some colleagues there and they were saying, again, they want to do more sort of promotion of good health, helping to create that culture where people can really thrive at work. So I hope, again, if there's anything I can support you to focus more in that area, you know, I'd love to. And I just thought it's a really important time to look at our own health well-being of staff. You guys are amazing role models, seen as the specialist within your organisation around health and well-being. But have a little think about your overall well-being. On a score of 1 to 10, where are you at today, or majority of the week? How many minutes of activity do you achieve each week? And are you comfortable about talking about your own mental health, maybe out of work, but actually in your organisation as well? I think often being a health professional, we often think we should be the expert and we should be on top form all the time, but we're all human, aren't we? And actually, how does that affect us? Especially when we talk about workplace stress and capacity and all the things that will affect you guys as well. And does work affect your mental health? And, you know, what would you have said to yourself, or what have you done when you're feeling low, anxious, or maybe struggling? Do you reach out? Do you speak to colleagues and other professionals around you? And another area I always ask about is sleep. I think that's a fundamental pillar of our health and well-being as well. So yeah, just have a little think about you as an individual, as a health professional as well, but how you're feeling as well. And I think these are some really good questions to think about when we're seeing our patients and our clients. And I just thought I'd mention some of these tools, and you might have seen some and you might use some regularly, or it might give you a little food for thought. But we all often say, how are you, don't we? But we never often give it that time. The expectation one there around, you know, I'm fine, thanks, great. But the reality is, you know, we're all juggling all of those plates, and some days can be easier than others. The presentation I just mentioned at the NEC last week, I was working with a wonderful chap, and it was interesting to hear Nick talk about mental health and suicide. A few years ago, this gentleman was really struggling with his mental health and had a breakdown, reached out for help, and unfortunately didn't get that help, and sort of sunk back down, reached out again and got some help through a local men's talk club. I've heard nationally of the talk club now, and they use a fantastic scale of how are you on a scale of 1 to 10, what's your score? And I often use this with my children now, and they ask me, you know, how are you feeling today, Mum? What's your score out of 10 today? Have you had a good day? And I think just little tools like that can really just open that conversation up. And just having visuals and encouraging line managers that you're working with to use some of these tools could really help embed, you know, that genuinely interest in actually, how are you? And I really like this sort of chart as well, because I always feel in like, you know, I really want to be thriving. And I know for me, when I'm looking after my well-being, I'm sleeping well, I'm moving well, I've got good social support. I literally, you know, I am thriving. But actually, you know, sometimes it's just surviving. And I've been working with a school recently, actually, and they were definitely in the red amber zone area. And you could probably relate to that with some of the clients and patients that you're supporting. But again, I just think it's often really nice to use some visuals with your employees to think about where they are and actually how we can't sustain that. And again, another one there, checking your battery, you know, just to give people that gauge and reflect, and for yourselves, you know, to reflect on how you are. I know when I'm doing all my good things well and looking after myself, you know, I am a better mom, I'm better at my job, I'm a better friend, all those things. So there's just some nice tools there that you might want to utilize, or encourage line managers that you're supporting or HR professionals to try and, you know, some of these things where they can hopefully be more proactive and supportive again, rather than seeing people when they're already really poorly. I mentioned the essential ingredients, and again, I've done lots of work with Dane Carroll Black, and you know, we always say we can put yoga on and fresh fruit, and often people think that about well-being, but there's some fundamental foundations that we really have in place to really create that healthy workplace. So for me, you know, leadership behaviors, absolutely essentially. And I'm sure when you're working with your employees who might not have a great relationship with their line manager, that can impact massively on their health and well-being. And coaching skills, I've just recently done some revisited my health coaching, and I think there's some fantastic skills in there, and if we could encourage line managers to have those skills, be fantastic. And just getting that key commitment from that senior leadership. For example, in one of my trusts I worked with, we went to the board and challenged those guys to be you know, champions within a topic. So I had a wonderful guy who his wife had experienced cancer, and actually being a nurse herself, hadn't had the greatest support through her workplace. So he really felt passionate about this area. So at top level, he became the champion for cancer in the workplace, and at board level, really give us that sort of support and leadership to then try and infiltrate that throughout the organisation and get some good practice in. So collaborative teams, it's all about working together, and you know, you guys working with HR and line managers and the employer, when that works well, things can go really well. And then when that doesn't go well, I'm sure, you know, things can often break down, can't they, in communication. That clarity of roles as well, responsibilities and expectations. Are staff clear about, you know, what's being asked of them? And I think that flexible working is huge now, isn't it? But it also brings problems with the hybrid working and different things like that. But actually, you know, if we can be flexible and staff feel trusted and supported, it can make a massive difference. And some organisations can do that easier than others. But I do think there's always a way if we can work with staff and to gain that. And trust is, you know, is essential. Workload and change management is always, you know, a really hard one, isn't it? Because again, just working in the school at the moment, I'm working in workload, it's often out of our control. It's being put on through different layers of government to coming down to that local level possibly, and that's very difficult. Creating organisations that are psychologically safe to have those conversations. And I think if organisations have occupational health specialists like yourself, that's brilliant, because I think that often, you know, you guys can provide that support and encourage that as well. Recruitment and development essential, and having effective performance management and support. So that line management relationship key as well, absolutely. And for me, the one that never costs any money but has a huge impact, about valuing staff and feeling appreciated. And that goes for you as well in your professions, and are you valued and appreciated in your role as well? So for me, if we get a lot of that right, it really sets the culture. around creating that healthy workplace, and it takes sort of all levels to really engage in that, but you've got to have that support from the top to really embed. For me, it's embedding wellbeing in everything that we do. Just to touch on briefly, some of you might have come across Professor Michael's West work, and he's done a lot of work within the NHS about compassionate leadership. And this really struck with me working in the NHS at the time around having the, 3 key things for people to flourish and thrive at work. So having autonomy, having that control over one's work life, so that flexibility, and having, be able to put your values forward. Belonging, so being part of something, being part of a team, an organisation where you're caring for, respected and supported, for sure. And then that contribution, I always say we all come to the best we can give, don't we? Most of the time we do our very best, and it's feeling like that's making a real difference and we're being effective in what we're doing. And all these 3 really need to be in place to help us thrive at work. It's definitely worth reading a little bit more if you've not come across Michael. I put the link there as well, which I'm very willing to share the slides, because there's some really great stuff around compassionate leadership. Again, I know you guys will be all for this, around that importance of ones-to-ones and that line management relationship, and having that to strengthen that relationship between the leaders and their teams. So improving productivity, building that team loyalty, and it can really benefit everyone. For me, the quote at the bottom just sings out: you spend so much time finding great people, it's worth it to help them grow to be the best they can be. And often, again, I think we often see people too late when they're struggling down that journey, and I'm sure you've come across that, when people are then sort of sent to occupational health or come to you through a referral. Whereas actually, if we can get in there before, again, being more proactive, it can help them to grow their best. And I know often that relationship with line managers, HR and occupational health can really, if you all work together, can make a massive difference in that. And I know my colleagues in the Occupational Southwest network say that that's something that they, has really helped when they've got all that communication going well. So thinking about all these sort of ingredients, one key thing for me around promotion is being active and movement. And it's sort of what I did my degree in, it's my real main passion. But I think in the workplace, physical activity, it can make a massive difference, actually. And actually, our active employees take 27% fewer sick leave. So it's something really positive to do. I think it's something that, it can be free, for example, like walking, and, in a workplace can bring people together. Only 35% of GPs currently actually know the Chief Medical Officer's guidelines. So we're often seeing health professionals to have all the answers, but actually we don't always, encourage these preventative, knowledge-based, evidence-based messages in there. So I just thought, I'm sure you guys know it, but it's just a great refresher, to talk about what are the physical activity recommendations. So we want at least 2 days of strength training a week. We encourage 150 minutes of moderate intensive exercise, or 75 minutes of vigorous. And I always say, well, what does moderate mean? And I always talk about, well, if you can have a walk and talk and you can hold that conversation quite well, but you can feel your heart, pumping, that's a good level. If you can walk and maybe sing, which I definitely can't, then you're probably not working hard enough. And if you can't hold a conversation and you're grasping for breath, maybe take it down a little. So that's a really nice way I often explain to my clients around, getting that intensity level right, just getting that heart rate up. And for older adults, 65 plus, we also really need to encourage at least 2 days of flexibility and balance as well. But the great thing about the recommendations is that every minute counts. So some is good and more is better. But for people who aren't near that recommendation, just doing 10 minutes, 20 minutes and building that up can have a massive difference. And that's where I see the workplace in, if we can encourage more movement, sedentary behaviour now in a lot of organisations when we're at work is crazy. I'm sure we're all sat here behind a screen, for this next hour. So it's trying to build in activity throughout your day. But that's essential. And the reason about it is because of these amazing statistics the evidence base are now behind activity is fantastic. And just this morning, I was on a call, a conference with Dr. William Bird, who did some really great work around mental health and physical activity and the benefits. And in a few weeks, I'd love to share the slides, some absolute amazing data and research about specific types of exercise. But for here, for example, if you're meeting those regular guidelines, you're 40% less likely to have cognitive decline. And I'm doing a lot of work around older adults at the moment. So dementia is a real worry for many of us. So a huge reduction in risk. Hypertension, depression, nearly 50% reduction in depression. And again, if we think about mental health conditions and illnesses now being the biggest reason for people taking time off work, a lot of these would have a massive impact in helping people feel better if they were more active. So can we provide opportunities within the workplace to keep that movement going? And even in cancer, and I'm sure, you know, in your roles, you support and work with employees who are suffering cancer in the workplace. And again, are we confident to encourage activity? And I've worked with some fantastic people with Macmillan Cancer about physical activity helping that recovery as well as work and reducing risk of breast cancers by 20%. So many benefits of helping people lower health risks, which is amazing. And for example, here, I love this little picture of a brain scan, just by having a quick 20-minute walk, lunchtime walk. And I'm sure you all take your lunch breaks. You know, the increase in our cognitive function increases. But I always get in the workplace, oh, I'm too busy, I work through lunch. But 20 minutes and you will actually come back more productive. So, you know, real brain scans here showing that evidence. For me, I just the professor of medicine at Harvard University. Walking is as close to the magic bullet as you'll find in modern medicine. If there was a pill that could lower the risk of chronic disease like walking, people would be clambering over them. And that's absolutely true. You know, if we had those up on a pharmacy wall and you could get your vitamins and it had all those percentages of reducing your risk of all those diseases, people would be, you know, grabbing them. And there it is. It's free walking, you know, and for me, living and working in Cornwall, you know, we've got such beautiful countryside, but I'm sure, you know, all over England, we're very fortunate, aren't we, to have that. So that's something, you know, I feel really passionate about and getting that message out there. So I hope you all do walking meetings. I just thought as well, you know, being occupational health professionals, I'm sure you're working with a lot of people with long-term conditions. And people often worry, you know, especially when they've had a health scare or are living with conditions, you know, what's my risk? You know, can I, you know, can you recommend activity? Can I do it? You know, am I going to get out of breath? And I used to work with a lot of cardiac patients, actually, so that was a big fear. But actually, we've got some amazing evidence that benefits way outweigh the risks. So we really want to encourage people to, you know, increase their physical activity. They're going to have much more risk of, you know, having a poor health condition and increased risk of disease by not being part of physical activity. So there's a great consensus statement come out as well. So I hope you've all seen that. But again, if you need any info, more info, do let me know. I just thought I'd mentioned one of the projects I'm working on. I work 2 days a week in Cornwall on the Live Longer Better programme, which I hope some of you may have heard of. It's with Professor Sir Muir Gray, a fantastic guy. He's 78 himself and did set up all the cancer screening years back and always worked in the field of public health. But he has a real mission and he has 46 active partnerships across the UK now who are working on this Live Longer Better programme. And he wants to work with to help develop a new culture. And he wants to go from care to enablement using activity. So not just encouraging physical activity, but that importance of our cognitive and an emotional. So connecting with people, using our brains, you know, maybe going to bridge club or connecting with people, all those sorts of things. But it's all about increasing the health span. So we might be living longer, but are we living longer in that health span? And I'm sure in the workplace now, we're working longer. We've got, you know, healthy aging as a key area for the workplace to look at. You know, it's really important that we, you know, may include this. So I've just put a few, 2 links on the bottom there about the national programme and some of the work that I'm doing in Cornwall, just to give you a flavour. But there's some fantastic evidence and work happening in that area. So I just, again, thinking about older adults in the workplace, that might be an area you'd like to look at. Thinking just about mental health as it's sort of like a key area to think about, mental health being one of the biggest reasons for absence. Again, I think often people see mental health as a negative, mental ill health. But actually, I like the one at the bottom there. Mental health is defined as a state of well-being in which every individual relies on his or her realizes their potential, can cope with normal stresses, can work productively and fruitfully. So I really like that one, because for me, it's about being positive. We look at our physical health and our mental health. The benefits, there are so many, as I mentioned, and I won't go into huge detail, but there's so much research and evidence on all of these. So it's a great one, when we're trying to support people to think about encouraging activity. How can we support that within the workplace? And again, I can't not mention sleep. I've done my sort of CBT training in sleep, and often I think it's a fundamental pillar of our well-being that we haven't talked about lots in the previous years, but I think it's so important. And again, just that link with nature and sunlight, really fantastic. And I don't know if any of you guys have seen Dr. Matthew Walker's books or podcasts about sleep. They're really good and can really sort of help. And I know when we're talking about menopause and sleep for women, it's that can have a massive impact. But I just thought I'd mention sleep a little bit, because I think there's a big area that really can affect our mental health. Then that sort of affects our workplace, our productivity and all those things. So I think in the workplace, it's an area that we could, again, within your roles, do more around sort of supporting sleep and education and those sorts of things. I mentioned men's health, and Nick did at the beginning there. And, in the workplace, for me, suicide, it's come up a lot, especially around men and young men. And, it is the biggest cause of death for under 35s. And it's been a real pleasure, actually, to work with that gentleman in North Somerset around the talk clubs and the impact that's really had. A real case study. So if you ever need a speaker locally to talk to your men in, contact your local talk clubs. They're absolutely fantastic, offering, free confidential support for men. So there's just some statistics there. And again, the Men's Health Forum produced some fantastic resources. I was working in a car garage last year, and we got some of the resources which are based on the Haynes car manuals. Again, so they're brilliant. They're written by men for men around a range of health topics. So some really good stuff there to access. And again, just some more here. And I think it's really important about that unskilled worker and the inequality gap as well. And you might see that within different levels of your organization and the sort of types of work that your employees might be doing. I can't not mention the menopause and women's health. It's really come up the agenda this last few years, which is great. And there's a new women's health strategy, and I had the privilege of hearing about that a few weeks ago at the NEC, again at the Health at Work conference. But again, something that I think we're talking more about in the workplace, which is great, but we're still not there. There's a lot of work to do, and the statistics are around one in 4 women thinking about leaving during menopause. It's frightening, and we need to do better. And I hope that within your role, that's something, again, might be more proactive and supportive, supporting line managers on how to feel more confident maybe to talk about these things would be fantastic. Again, I can't not mention the dangers of musculoskeletal health. I do work with Professor Wolf, who did the webinar for you 2 months ago, I believe, and it's something me and Tony are really passionate about. And I don't know if you knew what our average there is, but it is actually 9 hours now. It's incredible. 9 hours of sedentary sitting, and the dangers of some of those statistics are on there, which is not great. And I'm sure we all feel it when you're working away at desks and things. So something to really think about. And again, how we can lead by example and do that. So again, just some statistics here around the importance of musculoskeletal health. Still the second biggest cause of sick days and lost work across the UK. And just a few more things to talk about is, just have a reflection about what you guys think, your organisation and you're doing already. What really matters to you in your profession, but think about you as well and what your workplace is doing for you. and have a think about any suggestions, and I'd love to hear them at the end as well if we want to share any what's gone really well or things that you'd like to put in place. And again, I'd love to share and hear from that. I won't go too much into this, but I just thought it'd be nice to pull out some data from a real an example. So the annual NHS staff health and wellbeing annual survey now shows that sickness absent rates are actually higher in the NHS than the rest of the economy. And some of you might be working in the NHS now, and some of you are in private. But it's frightening that, you know, and again, quite reflective of the economy, anxiety, stress, depression, the biggest reason by a mile now of lost working days, followed by musculoskeletal problems. So, you know, but what's really frightening is that 1 in 9 staff are thinking of leaving the NHS every year. And we all know in the news around the strikes and conditions that staff are working in. So just some important data. And, you know, do you collect data in your organisation? Do you have data that you look at? Do you pinpoint? And this is the sort of thing that often can help then create the business case to really focus on well-being. So again, just I thought I'd share this so you can get that sort of data. Again, some of this data around the key health and wellbeing scores in the NHS, really quite depressing. Everything from sort of 25 to 70% here, mostly negative around, you know, what the impact of stress and wellbeing have on there. Great though, for example, that 68% felt that their line manager did take a positive interest. So that's brilliant, but there's still 32% not. So we really need to take that higher. And I think that's where you guys can have a real positive impact as well in providing that support to staff. Again, yeah, some data around burnout. Sure, within your organisations, you see that with your staff as well. Again, between 20 and 40%. So some high statistics there, quite a negative picture. But data we really need to look at to then, you know, underpin what is causing this, what can we do better within that organisation to support these staff not to feel like this. So just some data to give a picture around the NHS. And, you know, I had the privilege of working as a health and wellbeing lead within a local trust here in Cornwall. And for me, it was about those basic needs, you know, getting those fundamental things right around access to water, breaks, all those things. And I used to always say, you know, if I'm seeing a nurse who hasn't eaten, she's been on shift for hours, you know, she's not had any food and any breaks, she's not going to be top form, you know. And I always think that try and look at it from a patient point of view. And one thing we did was introduce a wellbeing hour, and that then reflected in the patients, and then patients started taking these wellbeing hour with staff, and it was a really positive thing. So there are things we can do, but we first of all need to get those basic needs and of level of care for our staff in place. So that's just a little example in the NHS. So what sort of things, you know, can organisations do? And I hope with your support, you know, we can get more and more of these sorts of things. And often it's simple things. For me, small changes can make a big difference. Leading by example is a real key one. And when I was leading my team, I always did walk-in meetings when I did one-to-ones. It's not always possible, but I always think even if you did half of it walking, came back, sat down, write your notes, there are things we can do. Having wellbeing spaces within organisations are great. They're becoming more and more popular, which is brilliant. Lunchtime walks, or at least using your lunchtime and not losing it. Again, are we all guilty of that? Do we work through? I mentioned the wellbeing hour there. That's something we did in the trust, and actually a mental health trust, which was really difficult due to wards and times, but we broke that 1 hour down into 10, 20 minutes, depending on the circumstance of the ward and what worked for their team, and they had control of that. But it was probably the best thing we ever implemented in that trust from the staff feedback. One, it sent a message from the top that their well-being was really important, but also, you know, they had that time to literally, you know, take 10 or 20 minutes out and do something to support and be positive around their well-being. I mentioned the men's health work. There's some fantastic toolbox talks from the Men's Health Forum. There's the talk clubs nationally, which are doing some brilliant work. Lots of work on menopause, for example, menopause cafes, webinars, support groups setting up within organizations. So again, you know, are these things happening in your organization? Can you help facilitate or, you know, start them off and get staff to lead them? In some areas, for example, in North Somerset, they've got a Healthy Workplace Award programme, and that's often great because they provide a framework to capture what you're doing already really well around wellbeing in your workplace, to then, you know, what maybe you want to think about in the future. Embedding wellbeing conversations into every conversation, and I think this is something you guys could really do, and encouraging your line managers to do as well, and just bringing in that scale of, you know, how are you on a scale of 1 to 10, but starting every one-to-one and every conversation with that. And, you know, other things there that I'm sure you've heard of or might already have in place within your organization: wellbeing champions, mental health first aiders, coaching, those sorts of things. Crikey, it feels like I'm really talking a lot, so I will finish soon with my questions. But this is one thing, you know, that I offer as well around health coaching, which has been really great. And I think, you know, to really support someone, to get them to use their own knowledge, skills and confidence, to, rather than us telling them, you know, to get them to own that, you know, own that responsibility and come up with solutions themselves. And I found this working really well on a one-to-one basis. So again, that's been working well for me, and I hope, you know, some of you guys use that approach as well. There's lots of things around webinars and face-to-face topics that we can support with, and actually, you know, implementing good practice. So actually putting things in place, action, seeing, so staff can actually see visible things changing. So often there's quite a reluctance to think, oh, I'll never work, it'll never stick. But, you know, keep going and putting those things in place. And I can help with any sort of, you know, bespoke programs as well, if that's of interest. Just some top tips for self-care there, you know, have a read of those through the slides, but don't forget your own self-care and leading by example. I really truly believe in that. And you know, setting your own goals. You are the biggest asset within your organization, and all your staff are. So it's about looking at them healthy goals and making a pledge to yourself and to your employees as well. I've tried to put a few resources in, information as well, which I hope would be useful, some good practice guidance, some toolkits around occupational health and well-being, and just some other resources as well. And just to summarize, for me, you know, you guys are key within an organization, and if organizations are lucky enough to have occupational health, I think it's absolutely fantastic. And I feel you've got a great responsibility to be a good role model. And hopefully, and with your knowledge, experience and expertise, engage and influence that top level, really get them to buy into health and well-being, go more that proactive rather than that. I love the quote by Desmond Tutu: there comes a point when we need to stop pulling people out of the river. We need to go upstream and find out why they're falling in. So for me, that's really, really important, and use those sort of, you know, that proactive preventative approach in doing that. Use those key ingredients that we talked about earlier, that Jane Carroll Black hopefully advocates. Look at that small change, big difference. Little things, you know, the hydration, the messages, those little questions, how are you? You know, giving people that time. People start to really, you know, really take notice of that. Support line managers to implement good practice. You guys are brilliant at that, you know, in getting them to think about why this is important. And embed and utilize every contact. So talk about activity. You know, every time your patient comes in, I know time's tight, but just try and, you know, simply put some of those seeds in around activity, asking what they're doing, trying to get them to be preventative and take on that responsibility of looking after their own health. Embed well-being in all that you do, and let's go proactive, not reactive, and take some action. So thank you so much. I'll just leave you with a few thoughts there. In order to make people happy in their work, they must be fit for it, must not do too much of it, and have a sense of success in it. And I think they're really, really nice quotes to finish on. There's my contact details. I hope it's been useful. And if anyone wants to contact me any further information after, or a little bit more detail in the elements, thing is with wellbeing, it's so wide and varied, but that's the bit I love, because, you know, it's so varied that, you know, keeps you on your toes. So thank you very much. I hope see if you've got any questions.
Thanks, Rachel. That was really great. Actually made us quite sort of thirsty to rehydrate water. All that talk. So, oh my God, maybe I have not been drinking enough water. So that's a basic one from us. There's an interesting point from someone on the chat about just difficult to engage with people who are very busy. You know, got their own work pressures, staffing issues. So how can, you know, what kind of conversations do you have with people who just say, well, I just can't do it? I mean, how can you do that kind of change conversation? Any suggestions?
Yeah, I think it's really difficult. And I often say to people, the thing is, we're probably going to be busy this time next week and in a month's time as well. So it's really the point when we need to try and, prevent that happening, because then what happens is more people go off sick. It has a higher impact on the rest of the team. So for me, it's just trying to get them to think about why it's so important. And that's why I mentioned that proactive rather than reactive. And if we can help people think about that, otherwise we're always going to be chasing our tail, really. And it's about that, looking up at the top of the river, getting back to that top of the river, but trying to really, and it does take time, because often that's a cultural change, and there are things that are out of our control. But if we can control what's, look at what we can control, that's really important. But get them to think about, the here and now, to try and prevent better for the future, really.
Yeah. We also had a report launched last week from Kevin Teo on staff wellbeing, some examples, and looked at rota shifts and various examples of how you can improve wellbeing in organisations. So do have a look at that. Also put in about sleep, some tips for sleep, because I think sleep's important. I'm keen that people have the opportunity to pose questions to Rachel, just put your point across. As the Horizon Occupational Health has expanded with multidisciplinary professionals, what's the role of OH in stress management and workplace during fitness assessment? That's a good old question. I don't know if I can answer it. I don't know if you can, Rachel. It's a tough one, isn't it?
It is, yeah. Stress management. Yeah.
Maybe Devi, you want to reply to your own question and say what do you think the role is? I don't know, Devi, you're still on mute, but maybe you want to keep him quiet, thinking it through it. Heather, thank you, Rachel. I really liked your emphasis on behavioral science, putting tips and strategies into action. I agree. I'm a principal health psychologist, and the all-important aspects of how we can empower people to make changes rather than telling them. Absolutely, yeah. That's really at the kind of nub, I think, of what you're about, Rachel, isn't it?
Yeah. I think that
Heather.
I've been doing a lot of work with sort of some schools recently, and chatting to them like on a one-to-one, using the health coaching and that emphasis around that. And I just think it, just giving people that self-belief, and that they, to realize their own potential, and they can do this. And it's just often giving them that time to then really think about some of the goals, and they've often got the solutions, but when you're in the midst of it, you can't see that. That can really bring people on, I think.
Devi, I don't know. Yeah, Devi, I don't know if is there any cross referrals to psychotherapists or workplace conflict resolution? Yeah, I'm interested to know your views about that, Rachel, and how you refer on, who do you refer to?
Yeah, well, definitely. Obviously, it's about linking people with the experts in that field. So, for example, when during the pandemic, for example, we set up a staff and wellbeing line for NHS staff, but we had a tiered approach. So we had, like, things we could really support them with, but then if it needed escalating to a psychologist, for example, we would do that. So yeah, I think it's important to have those connections, that partnership, and ensure that you do work with others and connect them, really, and bringing people, with the right tools and experience to try and, reduce that conflict resolution, for example. Yeah, I think it's important about having that cross referral partnerships with the organizations, even if they're outside your organization, to make sure you've got that. And I think that often works in a workplace as well, having that, someone outside that they can link to.
Thanks very much. Anyone else want to make a comment, or anyone want to come off mute or go on video just to say about their work in wellbeing and how that fits in with occupational health in particular? David said thanks. No, any final thoughts? I mean, when you did this presentation, Rachel, and you're thinking about that crossover, what kind of reflections did you have in terms of your wellbeing lead and the link with occupational health? Have you got any further reflections on that? I mean, we're just, as you can see, we're really interested in that combination, working together, the partnership.
Yeah. Definitely. When I was staff health and wellbeing lead, often it really, you know, for us, occupational health were, you know, amazing. And I was so fortunate in Cornwall to have one particular nurse who totally really believed in that prevention. And so we worked for years actually. And so I think sometimes it's just meeting the right person within that team and having that connection. And you know, so I was really lucky there. Often that broke down between HR sometimes, having different sort of opinions and support in you know, in trying to get real help for that individual and the line manager. That's sometimes where the conflict came, even within the NHS. So for me, it was really important to all be working on that same, you know, sort of working together for the needs of the employee, you know. That should really come first. So yeah, I mean, I think I had quite a positive experience with our occupational health team, but I think I was so lucky that I had a, you know, particular nurse who really engaged in that wellbeing agenda, and I'm sure you're the same because you're here listening, which is fantastic. So I think sometimes it's about building those relationships. Yeah. And I'm presenting to the Southwest Occupational Health Nurse Group in May, and again it's brilliant because they're recognising and linking into that support and just keeping those relationships, so that then again I can refer to them if they need that expert support or guidance in an area that I can't provide, you know. Sorry, I think you're on mute.
Yep, I am. I'm a lead physiotherapist at staff wellbeing. Also lead a small health promotion group with the health board to do more offensive work. That's been really helpful. Thanks. That's good to hear. I was talking to what wellbeing, who are kind of an evidence-based group looking to develop the evidence base and wellbeing, and they said we need to put everything in one bucket, which I thought was quite an interesting way of looking at things. I'd be interested to, we've got Lanry here, our presenter-elect, so welcome, Lanry. From my perspective, also a question around sort of diversity, inclusion, and how well-being fits and is kind of specific to particular groups' needs. Have you any thoughts about that?
Sorry, can you just repeat that? The phone was ringing at the same time.
That's fine. So I suppose my question is about diversity and inclusion and how you think there might be specific areas. You talked about the menopause, but you know, perhaps going further and for particular groups and needs. Have we put something, a blog around Ramadan? You know, Ramadan I think just started. What was your thoughts about that, or any particular things you want to highlight?
Yeah, no, I think it's really important. And again, within the NHS Trust, we had a health and wellbeing group, but we also linked very closely with the equality and diversity group, again, just to make sure we were meeting the needs of different staff who, you know, so it's just really important to be aware of all those things, isn't it? And come down to that individual when we're supporting that staff member to make sure we're thinking of all the things that need to be in place. And then at an organisational level, yeah, to have different things in place, like, you know, organizations are looking more at a menopause policy, but again, it's having the policy but putting it into practice, and then having that support from managers who maybe lack the education or the confidence to have those conversations, really. So linking in with those teams to help support and encourage, you know, training on that, really, so that it all sort of links together, doesn't it? It's all part of it, really, and just making sure we can support that.
Thanks. I put in a blog about Ramadan that someone did for us, which was really helpful, and there's also mental menopause resources. Devi's saying, curious to know, are jobs more openings for jobs for nurses compared to other professionals? I suppose from my I think more there are more openings for nurses, but there's also a shortage of occupational health nurses. So we're seeing occupational health technicians. There's also a lot of occupational health doctor recruitment, particularly diploma occupational medicine doctors. And there's these two great courses that actually Lanry and others are delivering against, which are diploma occupational medicine and diploma occupational health practice that the faculty are examining against, and that people are delivering. So yes, there is a growth in the workforce, occupational health workforce, and obviously you want well-being to come along with that. We're nearly out of time. Unless there's any further comments or questions, as mental health is getting demanding priority. Not quite clear on that question, Devi. As mental health is getting demanding, is opportunity for psychotherapists? I mean, there are opportunities. I think just look out, on the various job sites. So there definitely are opportunities. Any final comments from you, Rachel?
No, just thank you for the opportunity. And yeah, I mean, it'd be great to hear more. If you do any really good work around wellbeing in the workplace, please share it, or shout about the great stuff and the case studies, because I think often it's about celebrating that success and encouraging others to share that good practice, for sure.
Good. All right. Well, thanks everyone. Have a good rest of the day. Keep in touch with each other. Thank you, Rachel, and for your time and your presentation. Very clear, and we've learned a lot, and many people have said that too. Thank you for the session. And let's keep the conversation going. Let's keeping the tie up between occupational health and wellbeing. So great stuff.